You're watching Medical News Network, your trusted source for the latest in medical news and information. I'm Mike Wittgenstein, and thanks for joining us. Today we'll discuss cutting-edge training and technology available with the co-founder of the Dental Implant Institute, an international training and educational institute for dentists and dental implant treatment center for patients. So if you know there has to be a better, quicker, much more painless way to deal with dental problems, you're right. Stick around. We'll be right back. Welcome back. We're in studio with Dr. Jennifer Cha, a diplomat of the International Congress of Implantologists and director of the Dental Implant Institute, a Harvard-affiliated training center for dental implants. Dr. Cha, welcome to the show.
Thank you, Mike.
First, I want to thank you for coming back on. I've had you on once before. We actually looked at the work that went on at the Institute, the implants, the gum disease, which kind of got me a little bit more interested in actually how you and Dr. Chen, your partner and husband, developed the Institute and what you do there.
Well, we're both surgeons. We're periodontists. That's the dentists who treat gum disease.
Okay.
So we have the basic surgical knowledge, and dental implant is the new wave of dentistry. Any missing teeth or any dentures, it's passé.
Right. So what brought you and Dr. Chen to start and develop it? And it's now an international organization. What made you decide to create and offer this kind of training to dentists?
Well, Leon invented a couple procedures. One of the procedures that I am very proud of is it's a technique called the hydraulic sinus condensing technique. The upper jawbone is the most difficult area to place implants.
Right, it's very hard.
Okay, because there's a sinus, which is an empty space above your upper back teeth. And usually when patient loses teeth, which is a very common area for patients to lose their teeth, and it's an empty space, there's not enough bone height to place implants. So Leon thought of a better way than traditional method, because traditionally to graft the bone, doctors in the past have went to the hip to get bone, sometimes to the skull to get bone, sometimes to the chin to get bone.
It was gory, for lack of a better word, to think about them cutting bone out of your hip to put in your mouth so that they could put an implant in.
Well, they're just thinking of a good quality bone, but it creates another wound for that patient. Sometimes those donor sites can be more painful than the actual surgical site. So ultimately, all you want is dental implants to be able to chew and enjoy your life.
Right.
So Leon has developed a new technique through the same hole that you would place implants, not creating an extra hole or anything like that.
So you go through the same hole the implant's going to go through?
Yes. And just gently ballooning up and raising the membrane of the sinus and grafting small increments of bone, little at a time, to gain enough bone around the implant so that it'll be able to hold the implants in place. And that cuts down the treatment time as well.
Okay, now you made mention to me before, because I asked you about how Leon comes up with these things. You said he's a bit of a tinkerer, I think was what you said, and he keeps trying things and finding new things. What to the patient and to a doctor in private practice, what kind of time frame are we looking at? How much time are they going to save in pain? Are they going to save with the chin hydraulic sinus condensing?
Well, traditional method of lateral window technique takes about minimum 18 months, because not only you get bone from other parts of your body, and you have to put the bone in and you wait minimum 6 to 9 months for the bone to harden. And once the bone is hardened, then you go back and drill the hole to place implants, and you wait another 6 months for that to be solid in your jawbone. Then you can start making the teeth. So the way that Leon's technique works is that you put the bone and the implants all at the same time, so that you're healing together. It's similar to you're putting a post and pouring cement all at the same time, so it hardens, it's more solid. Then you start putting your teeth, and it only takes about 6 months of healing period, so that cuts down a lot.
But you're only going through, you're using one cut instead of 2 cuts in the mouth, and you're not cutting anywhere else on the body?
No. I had patients had that procedure done, hydraulic sinus condensing procedure done, and the next day he told me, yeah, I went to my son's soccer game, and I was fine. No swelling, hardly any pain. And in 6 months, he had solid implants. We placed 2 crowns over, and he was very happy. He didn't even know there was another procedure that was more difficult and
So he had no idea that the other one even existed. And I interviewed dentists all across the country. And with the exception of those that have been through the Institute's training, most of them still use the lateral where they come in from the side and they do the multiple surgeries. Do you think that the majority of dentists do that still because they haven't found out about it, they're not trained about it? I mean, is that one of the reasons that you opened the Institute?
Well, the difficulty of that technique kind of scares the doctors away from performing that technique. So with this new technique, it is so fascinating to these dentists who do not want to do such an invasive procedure.
Right.
He is invited from all over the world to be speaking on this technique.
Right.
And when he spoke, there are doctors who wants to attend to learn the technique more in depth. And that kind of, one thing led to another and snowballed to the point where we have to have a facility to train these doctors on this new technique.
Okay, we're going to take a look at the facility here real quick. But first, I understand that you guys have trained now over 3,000 dentists?
Yes, all over the world.
From all over the world. And Leon and you both lecture all over them. He's in Australia. Every time I call you, he's somewhere lecturing on the...
Yeah, actually he lectures more than I do because he is the inventor.
He actually patented and invented the procedure.
Yes. And he couldn't be here today because he's in Salzburg in Austria.
Out lecturing.
Yes.
All right, well, let's take a look at the first picture real quick. And this is just your implant institute. Now, this is a second one that you have, is it not?
Yes.
Okay, and this is just now is this a group of graduates that have gone through the institute?
Yes, this is actually an international course. It's a combination of Harvard course. These are Japanese doctors.
And I do want to put out, you are a Harvard-affiliated school.
Yes.
Okay.
Yes. These are Japanese doctors who just heard a little bit about hydraulic sinus condensing technique, and they come for a 4-day course.
They came here from Japan.
From Japan, from Osaka actually. And they get to learn from beginning to the end. These doctors actually have placed many implants, but they want to learn that special technique that Leon invented, one being hydraulic sinus condensing and another being vertical translation, which is very, very important to get good results for bone grafting.
All right, let's take a look at the picture before this one. And I think this is this is the institute in Las Vegas.
Yes.
This is the main institute. Now, your training facility is here, and this is also a working dental office, is it not?
Yes, we treat patients, and we place thousands and thousands of implants.
So the learning part isn't just in a classroom watching something. These doctors actually get to go and watch you and Leon perform these procedures on live patients in the institute.
Yes, we perform the procedures, not the doctors. The patients are not being guinea pigged or anything like that. So the patient is being actually treated by us. However, they watch through the video.
The doctor gets to watch it happen.
Right, and of course we get consent from the patient.
All right, let's just take a look inside. There's a couple pictures down from this one. Inside. Now, this is actually inside the institute. That is, if I'm correct, that is one of your viewing rooms or observation rooms where you do the procedures and the doctors can watch?
Well, that's one of them. We have 3 rooms just like that. We have a regular scheduled live surgery where doctor watches through the camera. But at times, we do get some emergencies where we do not have camera facility, but they can watch through the window.
All right, let's take another look at the next picture real quick because we have to take a break here. And this is an actual operatory inside your facility.
Yes, our surgical suite.
I want to tell you, and I have to point out, I've been there. The colors are so, it's almost like being an orange sherbet and the greens, and it's very relaxing and peaceful. We have to take a quick break. When we come back, I want to talk a little bit more about the Chen hydraulic sinus condensing, and then about the vertical translation that you do with gum disease, because that to me is amazing. So when we come back, I want to talk a little bit about that. You're watching Medical News Network. I'm Mike Wittgenstein. We'll be right back. Welcome back. We're in studio with Dr. Jennifer Cha of the Dental Implant Institute, a Harvard-affiliated dental implant training center. Now, Dr. Cha, before we went to break, we were talking about the Chen
hydraulic sinus condensing technique.
All right, I know Dr. Chen, like you said, was a bit of a tinker. He's also developed with the gums, a vertical translation.
Vertical translation technique.
Okay, before we go into that, normally to deal with gum disease, proven for years, they've gone to the palate of your mouth, taken out a piece of tissue, placed it on your gums, waited for it to heal, and then taken another piece out and placed it on the gums. It's been a very brutal.
Yeah. Well, actually, it's not to treat the gum disease, but sometimes you get gum recessions or gums are pulled away from the teeth and you have roots exposed. It's more of a structural defect, and traditionally, you get the gums from the roof of your mouth, and sometimes that's the more painful part than the actual surgical area. So at times that is still being done, but the whole purpose of getting the gum to cover the roots, the main ingredient that's missing in gum recession or gum being pulled away is actually the bone. Bone is the one that's giving nutrients and blood supply to the gum tissue. Without bone, the gum cannot be there. If the gum is there without the bone, the gum is easily sloughed away. So we actually add bone to create that or cover the exposed root surfaces. Now, with the vertical translation technique, which is a flap management technique that allows you to pull and attach back to the grafted bone, but it's a very useful technique to graft bone for preparation for implants or in conjunction with implant surgery.
But doing it that way doesn't require that you cut any flesh off the palate or the roof of the mouth.
No, there is no additional donor site like the roof of your mouth.
All right, I want to take that picture we're going to look at right now is of Dr. Chen.
Yes.
And obviously you look at him, he looks like he's got a little bit of a tinker in him. Does he find it, does he do this? I mean, what really drives him to discover all these new things? I mean, is it something that he just focuses on and puts his mind to?
No, I mean, after the typical training from the dental school, and from the moment that he was in dental school, he knew there's a better and advanced way to do any procedure. Right. And he's a very, very innovative person. You know, he's one of those people who can think outside of the box. You know, he doesn't just think of, okay, there's many different ways to do one procedure, even in medical field or dental field.
All right. Now he is, so everybody knows, if we can go to the next picture real quick. This is you and he getting your diplomas from the International Congress of
Yeah, we receive our diplomatship.
Your diplomatship. And this was at, go the next photo real quick.
It's at the Bellagio.
This is at the Bellagio, and there the two of you are. I want to make sure everybody knows, and we'll go to the next photo real quick, that Dr. Chen has spoken to probably 200,000 or 300,000 people he has lectured to. Mm-hmm. He's well respected all around the world. It's not that he doesn't have stuff that keeps him busy all the time.
Well, he's being invited from all over the world to talk about this new technique and new ideas. And this happens to be in Dresden, Germany. He was among the many implantologist speakers from all over the world to give the general audience, which are doctors, you know, dentists and surgeons, what's new out there, what is the new innovative technique that can help their patients without having a second surgical site or without having more pain than necessary.
Do you think the techniques that he's pioneering today will be part of general dentistry 10 or 15 years from now?
It will become standard of care. I would say probably in about 10 years, because it's proven, it works without having to create more pain for the patient. It's a service to the patient.
Let's go to the next photo real quick. Now, is this at the same?
Yeah, that's still at the Dresden, Germany.
And he's up giving a lecture on the
hydraulic sinus condensing technique.
Showing how he is. All right, and the next photo? Same thing?
Same thing.
And with the Dental Implant Institute. This looks like, and we see the one more, the very next photo. These are large groups and crowds of people.
Yeah, actually this was in San Francisco, I believe. Actually, this was what they call a showdown. The traditional technique of lateral window, the person who lectures in that technique, there's another doctor who lectures on osteotome technique, which is a small instrument that you tap, mallet.
Yes, I've seen that. You pound on.
You pound on to crack the bone. And then Leon doing the water pressure, ballooning up, lifting it.
It sounds much gentler and much more friendly. Yeah, humane. I just look and I see the work you guys do, and every time you guys come up with something new, I always say to you, who came up with that? And you always tell me Leon. And I know that you're out there, you're educating. Do you think that there are those doctors that aren't staying on the cutting edge that are going to starting to get left behind if they don't start learning there are newer things that are available to be, because I know there's still treatments going on from that little
Yeah.
mallet from 20
Well,
years
that's
ago.
why the patient needs to be educated to know what kind of procedures out there. I mean, patients these days are more smarter and they research a lot.
Do you think that there are doctors out there right now that either aren't doing procedures or are doing procedures incorrectly because they don't know where to go to get the proper training? They get into a rut, so to speak?
Yeah, basically they get into a routine and they just don't want to change, or it's too much trouble for them to change. But eventually it's going to be the patient who asks for that procedure.
Do you think that because the Implant Institute is now an international organization, that your exposure, you bring in doctors in from Japan, I know you bring them in from all over the country, that your exposure to what they do also gives you a better understanding and a wider variety to offer dentists?
Yes, not only we teach, but we get into this like a brotherhood, sisterhood, kind of a network, and we actually learn some new procedures or techniques that they do that become useful, and we share the knowledge.
Okay, because I take one more quick break. When we come back, I want to find out, because I know you're taking the Institute basically nationwide and around the world to help train people on how to do much more painless ways of dealing with dental problems. You're watching Medical News Network. We'll be right back. Welcome back. We're in studio with Dr. Jennifer Cha of the Dental Implant Institute, talking about training and education. All right, you were talking about a brotherhood as we went to the break. What do you think separates yourself, the Dental Institute, from most training facilities? Do you think it's the hands-on work? Do you think it's the quality of what you offer? Do you think it's the innovativeness? What do you think it is?
I would say it's the innovativeness of the technique. Leon, we don't just teach what's in the textbook. They can get there just reading a book. But Leon is really, really outside of the box. I mean, not so outside of the box, but it's...
Well, I have been to the Institute, so and have watched him. And if we go to this next photo, this was what amazed me the most. Is you'll see everybody is sitting down in the photo. He's got them involved. He's got them working. They're not sitting listening to a droning on lecture. They're actually hands-on training.
Yeah, these are hands-on workshop practicing what they just learned.
Now they'll go from practicing this, normally they'll get to view either you or Leon do a surgery.
Right.
Of this.
We have at least 2 live demonstration surgeries, so they get to see the real life, what goes on, even if it's a goof up.
Right.
But they get to learn how to manage
Somebody
that.
once said you never learn to get good unless you make a few mistakes. Can I see the next picture real quick? This one I kind of snuck behind, and this is after everybody's said and done. He stays around and continues to teach them as long as they have questions.
Exactly.
For as long as it
He has
takes.
a real passion for teaching.
You know, one of the things I noticed when I was there is that after he spent the day teaching everyone, the lectures he put on, everybody got home. Those that wanted to stay after, he stayed with them and went over everything with them again to learn. Is that something that he does on a continuing basis?
Exactly. He want to make sure that whoever comes through that training center really got the procedure. You know, he want to make sure that they can do the procedure just as good as we do, or even better sometimes. That's why they send us a picture right after they've taken the course. They go back, put it on. They give us a
photo of them doing
picture,
it?
yeah, before and after.
Let's take a look at another photo. And this is the same thing, I believe. I believe it's still him in the room with...
Yeah, I don't know, when did you get that picture?
Well, I snuck around after I was there for the day and got some more photos. All right, next one. This is basically the same group of people. He worked with them for, it had to have been a good hour and a half after the program was over,
Yeah.
making sure, and they all had questions, and he addressed each one of their questions individually.
Yeah, sometimes those doctors can keep us there until
Yeah.
late nights.
You made a comment earlier, and I know you probably don't know that I snuck these pictures out of there, but I found something out about your organization that was truly different from any I'd ever been to before. You talked about the brotherhood. You talked about building the bonds. You talked about keeping in touch and sharing and learning. And I came up just because of our prior show. I wanted to see what you were really doing. And at the end of the day, these people started showing up, and they were setting stuff up, and the center's beautiful. I mean, you're on 3 or 4 acres. I mean, it's gorgeous.
Yeah, thank you.
With the yard, and it was all set up. If we bring up the next picture, I walked outside to watch a luau going on with all the dentists that had been there all day. Not only them, But since most of them travel to you, they bring their families, because obviously in Las Vegas, it's a great place to have your families. But you get their kids, their wives, their husbands, you get their whole family to the Institute and get them out and get them involved and get them meeting each other. Is that just something you guys really love to do, or is there a benefit to it? What is the...
Well, it's like a reunion. You know, once we finish dental school, it's hard to get together with your friends and colleagues and talk about it. And it's really nice to be learning and still have fun at the same time.
Let's go to the next picture, because the next picture, I think, states the whole thing.
Yeah.
Those people were the happiest group of I stayed out of it so I could take it, but that was the happiest, smilingest group of people. The drums, the dancing, the whole thing.
Yeah, I have 5 children over there in that picture.
And it was just amazing to me that after 4 days, 3 days, because you offer all kinds of courses, do you not? Weekend courses?
They're mostly weekends so that they don't have to take time off away from their practice. They're usually Fridays and Saturdays. And just, it's only 2 days, but you get world of information.
I will tell you, I did meet a few spouses and kids who told me that they didn't mind the mom or dad or dentist going up to go to because they knew that they were going to get to go to a party when it was over. If you wanted somebody to know something, a dentist at home, somebody that really, really wants to learn something that will make them better, even a patient that knows that they don't need to maybe necessarily go through what somebody's told them they need to go through, what is it that you want them to know about the Dental Implant Center?
Well, our Dental Implant Institute is unique. It's not an everyday procedure that you learn. It's unique to Leon's ingenious techniques, and it works. And we do more implants than any surgeons out there, and there's a reason. If you just wait for a perfect patient with tons of bone to come in, that doesn't happen every day. You may be only able to do maybe 50 implants, 100 implants. To be able to service all the patient's needs, you have to learn some innovative techniques, otherwise you'll be turning the patient away.
Leon told me that you guys do close to 3,000 implants a year?
Oh, I would say more than that. We are